Have you ever received a medical report and found yourself staring at a page full of unfamiliar terms, feeling a bit overwhelmed about what it all truly means for you? It is a common experience, and deciphering these reports can sometimes feel like learning a new language. But what if you had a clear guide to one of the most crucial parts? The impression section of your report is designed to be the concise summary of the most significant findings from your medical imaging or pathology results. Think of it as the expert's bottom line, where your healthcare provider interprets all the technical details and offers their professional opinion or diagnosis, clearly stating what they believe to be the primary issues. This section is vital because it translates complex observations into understandable clinical statements. For instance, a radiologist examining an X-ray or a pathologist looking at a tissue sample will evaluate many tiny details. The impression is where they synthesize all that information, highlighting important aspects like the presence of a tumor, its likely characteristics, or other relevant conditions. It directly informs the next steps in your care, guiding treatment decisions and further testing. To effectively understand your impression section, begin by looking for key terms such as diagnosis, differential diagnosis, or findings. These phrases often signal the core information. If the report mentions a diagnosis, it is the doctor's most confident assessment. A differential diagnosis lists several possibilities that fit the observations, requiring further investigation to confirm. Pay attention to any size measurements or descriptions of location, as these specifics help pinpoint the issue. Do not hesitate to write down any unfamiliar medical words to look up later or to ask your doctor about during your next appointment. A useful tip to remember is that this section is often structured from the most significant finding to the least, giving you an immediate sense of priority. You might also encounter terms like consistent with or suggestive of, which indicate a strong likelihood but not an absolute certainty, prompting additional tests. Understanding this subtle language helps you appreciate the diagnostic process and the steps needed to reach a definitive conclusion about your health. Ultimately, grasping the details in your report empowers you to engage more meaningfully in your healthcare journey. Knowing what the impression section communicates means you can ask more informed questions, understand the reasoning behind proposed treatments, and collaborate more effectively with your medical team. It transforms you from a passive recipient of information into an active participant in managing your health, paving the way for clearer communication and a greater sense of control.